The medical charity Medecins Sans Frontieres sounded the alarm in April. Now, by the time the world put its act together, Ebola had become a global health emergency. As of October the 29th, according to figures from the World Health Organization, Ebola had claimed the lives of 4,910 people. There were also 13,676 confirmed cases as of that date. Now, this outbreak has been described as the worst in history and the slow response in the early months, an indictment of the global community. But a massive mobilization of resources and personnel in recent months is beginning to reverse the tide. CCTV's Nina Devries gives us an update from Freetown on the situation in Sierra Leone, one of the epicenters of the pandemic.
Here in Freetown, I spoke to Phil Nicol, the Deputy Minister of Information and Communication. Now, he says cases are on the rise in Freetown, but logistics are also being better put in place. For example, there are more vehicles available, more ambulances, contact tracers are being trained, more of them are being trained every day. There's also more military involved, dealing with roadblocks and quarantines. This is since Minister of Defense Paulo Conte has taken over the Ebola crisis. And now, in terms of public awareness, that is also getting better. According to the Deputy Minister, people realize Ebola is real. They are starting to take more precautions. Now, of course, the message still needs to be addressed. There are still people who are in denial about this, but again, it's getting better. When I asked him about how Nigeria handled the Ebola crisis, he said, first of all, Nigeria has a much better healthcare system, so they were able to deal with it a lot easier. And also, the Ebola was already in West Africa, so in a way they were expecting it and were prepared for it and knew how to deal with it. So that's why the response was also faster. He admits Sierra Leone should have responded faster looking back, but they are doing their best right now, and also that the international community should have responded faster. Nina DeVries, CCTV, Freetown, Sierra Leone.
Well, right across the border in Nigeria, and with no new cases after 42 days, the World Health Organization on October the 20th declared Nigeria Ebola-free. Nigeria had registered 8 Ebola deaths and 20 confirmed cases. So just how did Africa's most populous country beat the dreaded Ebola virus? Here's CCTV's Deji Badmus in Lagos.
When on July 20th, Nigeria confirmed its first Ebola case, many across the world and even in Nigeria felt the country had embarked on the proverbial journey of no return. The fact that it was happening in Lagos, a city of over 20 million people, didn't help matters. The initial task before health officials was tracking down everyone who had had contact with Liberian-American Patrick Sawyer, who died 5 days later on July 25th.
We're actually looking at contacting over 30,000 people in this very scenario.
The figure was eventually reduced significantly, and authorities were able to track down virtually all the primary contacts. Some, though, had made further contacts before they were tracked down.
We're now doing a list of possible secondary contacts for each person. They need to be followed up one by one.
It wouldn't be too long before one of the primary contacts in isolation succumbed to the disease, and the first casualty was one of the nurses that attended to the Liberian. 5 more Nigerians were to later die of the disease as the virus spread to the oil-rich city of Port Harcourt in Nigeria's south. But just as everyone thought the situation was about to spiral out of control, the country began turning the corner as more patients were treated and discharged. The treatment center eventually became free of patients. By October 20th, after having gone 42 days with no new cases and no one in isolation or under surveillance, the WHO declared Nigeria Ebola-free.
Nigeria has won the battle against Ebola virus, but this world war rages on other fronts in other countries. The war certainly, therefore, is not over. A reinforced Ebola virus could still invade Nigeria.
To prevent that from happening, authorities have stepped up screening at all the ports of entry into the country. And even though the public is now more relaxed, people are still cautious.
Everywhere I go, I make sure I wash my hands. For example, after toilet, I wash my hands regularly every day. Then after eating, before eating, I sanitize my hand. I have my sanitizer. As a matter of fact, right here in my bag, I have another sanitizer in my bag. I go with it everywhere I go.
At the very heart of Nigeria's fight against Ebola is the laboratory at the Lagos University Teaching Hospital, run by Professor Sando Milabu. It is here that preliminary diagnosis confirmed Sawyer had Ebola. Today, facilities at the lab have been upgraded, and Professor Milabu says if there's one lesson learned, it is that there's now more awareness on other kinds of hemorrhagic fever other than Ebola.
In terms of hospital readiness, so we now know there's a need for us to have isolation centers, because there are some communicable diseases that really need strict barrier nursing. So as we have with Ebola virus.
Most states in the country have now built isolation centers and set out special funds in case there's a fresh outbreak. Health officials now have a visible presence at the country's airports. Virtually every public building now has sanitizers in place. Even students too are now screened before they're allowed into the classroom. No one is surely letting their guards down. Deji Badmo, CCTV, Lagos, Nigeria.
Now, Nigeria's widely acclaimed Ebola success story is being cited as an example worth emulating, not just by other African countries, but the rest of the world. But what underlies that success? Joining us from Lagos to discuss this fascinating success story that is Nigeria is Professor Sunday Omilabu, a consultant virologist who was one of the very first health experts in Nigeria to handle the first case, Patrick Sawyer. In studio with me is Dr. Kizito Lubano. He is a researcher at the Kenya Medical Research Institute, KEMRI, here in Kenya. Welcome to the program. Gentlemen, thank you very much for joining us and welcome to the program. Now, Dr. Omilabu, I'll start off with you there in Lagos. Now, the World Health Organization has declared Nigeria Ebola-free. Many have described Nigeria's story as a spectacular success story. First, from your point of view, what is it that has made Nigeria's story successful?
Thank you very much for this opportunity. In Nigeria, I would say we were so lucky to have made that prompt diagnosis. Otherwise, the story would have been different. The fact remains that under 48 hours, we were able to fish out that the patient came with Ebola virus into the country. And that has actually given us that opportunity to put all structures in place to make sure that we don't allow it to spread beyond where we all now know as part of the history.
All right, let's just take for the moment with the medical facts here. What is the difference, though, in your approach in Nigeria with the approach of the other countries in West Africa?
The other three countries that were ravaged by this EVD, the diagnosis was not made very early. The virus had actually moved into far of the country, I mean the country cities. Before the diagnosis could be made, the virus had actually gone into a lot of households. And we know as the virus spread very fast. And before the whole world could rally around, the damage is already done. Even most people that were in contact were far away. They moved from locations to locations.
You're listening to this, Dr. Lubano, and we're watching across the continent as the other three countries still struggle when you know, Nigeria and Senegal have overcome the Ebola virus. In terms of monitoring and surveillance, though, how is it that Nigeria was so well prepared despite this virus having hit, you know, a city that was so populous like Lagos?
Yeah, I think maybe the reality is that being on the ground, and we have seen and read, perhaps being well prepared is not the story here, because this is just the first instance. And in terms of an epidemic, we shouldn't be celebrating so much, even though we should celebrate. This was the first instance, and we have managed to contain it. There was, if you look at it properly, a delay of about 2 weeks before even the health workers got into the system now of tracking the contacts and going to the homes of the nearly 20,000 people who had been exposed. Having said that, we know that Nigeria has been dealing, for example, with the control of polio. Right. And they have a very robust state-of-the-art polio eradication center, which quickly was repurposed in terms of using the same type of technology like geographic information systems to be able to track all contacts which, for example, this case had come into direct immediate contact with.
All right. Dr. Sunday, though, Professor Omilabu, to you there in Lagos, if this outbreak, though, if the first case had been in rural Nigeria, would you have been able to reach the same conclusion as you did in Lagos? Would you have been well prepared as you were in Lagos?
It would have been difficult if it were in the rural setting, because the information would not get very fast to the authorities who will direct efforts at curtailing it. We thank goodness it happened in Lagos, and the information started moving around, and that's what actually assisted us. It's not, it didn't happen in a rural setting, and we know as we have rural setting in Africa with the poor facilities and poor settings, which also make disease prevention very difficult.
You're looking at it, though, from neighboring Nigeria, and you're looking at the situation in the other countries. I mean, it is now, the cases have passed the 10,000 mark there. Is it getting worse, or is it stabilizing?
We are more or less stabilized in the country now, because there is active monitoring at our borders, the land borders, the sea borders, as well as our international airports are now being combed, monitoring passengers coming into the country. Even as they are going out, they are still being monitored. And there are questionnaires that they fill to tell us about their itinerary, about their well-being. So this one has been actually helping us to curtail the spread of the virus. And as we know, as a country, so far there is a country still having even a single case of Ebola. We know that a single case could be imported into any part of the world. And that's why Nigeria is not stopping at anything. Even though we are declared Ebola-free, our surveillance activities is still on. And the health education aspect is still ongoing by raising the level of awareness, which has actually helped us to stamp it out on time.
All right, so obviously a lot of effort has been put into this global and national as well. But looking at the Nigeria and Senegal story, though, is that offering much hope, though, to the rest of the region?
It does, definitely, that if you did things differently. But I like what Professor Omilabu is saying, that you need to have continuous surveillance. And I need to add here that from now on, for example, we have had the biggest outbreak that has ever been there, maybe over the last 500 or 1,000 years. So Ebola, in my view, is going to remain a permanent kind of entity for surveillance globally, and we need to keep our efforts in that direction so that we don't lose sight of that. I perhaps may need to quickly add something that there are efforts now to try and train the people who have survived to help in terms of taking care of the ones who get infected, because quote, now they are immune, but we can be able now to use them in a different way. So that way also we might still have people who can take care of others, as opposed to when we are losing workers and we don't seem to have other people who are brave enough to go and help out.
All right, Professor Omilabu, clearly Nigeria must have learned something from this outbreak. What lessons has this taught Nigeria, though, both from on a national level, and of course on a regional level as well?
Thank you very much. We have learned the fact that there is that need for us to heighten our surveillance activities if you want to nip in the bud any possible or feasible importation of any microbial infection. Secondly, we learned that there is need for us to put in place isolation centers. We are talking of Ebola now. There may be some other infectious agents. Flu are there, and they all need isolation. And of course, we know we have other viral hemorrhagic fevers around that will need isolation. At least with this Ebola platform, we know we've done rightly by identify a good number of isolation points, and as well the trainees received to curtail the spread of Ebola is in place, which we can use to check all the possible microbial infection in the future. I think these are the part of the lessons, and of course health education, we noticed that it actually helped, and we really need to sustain this to actually educate people and keep on educating them. At least people have imbibed the spirit of good hand washing. With Ebola or no Ebola, people now know that they need to wash their hand very well with water and soap. As we know that there is no cure for Ebola, but prevention is doing a lot of a good effort. All right,
Dr. Lubano, though Senegal and Nigeria have clearly become examples for the rest of the region, what are researchers, though, how are researchers looking at this position?
I think there are two lessons that, and maybe this outbreak has brought out. First, we quickly realized there were some products on the line that got stuck somewhere because there wasn't anybody having Ebola. But now these have come to the fore, and they are being accelerated to come to the market, like the new treatments and so on. The second thing is about acceleration of the vaccine development. And we know that, for example, anytime in the next few days, Kenya and a few other countries are going to be centers where the Ebola vaccine is going to be tried out. There is a lot of now other interest and aggressive research going into Ebola and perhaps other related conditions that might in the future help us to mitigate the impact of this. I want to add two other quick points that Ebola has brought across, and perhaps in terms of reminding us as Africans about our health systems. Right. That for the first time, this is one condition where you cannot perhaps seek medical care outside your boundaries, because the principle is you control it at the source. So I believe our leaders are also going to be able now to invest so that they know very well when it is something like Ebola, even if you are president or a prime minister, you cannot go outside your country, you have to be taken care of within the country. The second point is about resource mobilization. We have seen now even individuals, Africans, like a gentleman from South Africa donating $1 million. And this is a very useful point because we are used to Bill and Melinda Gates, but we are seeing our own Africans now, individuals coming up to bring on board resources to try and address disease. And those that includes Mr. Angote and Tony Elumelu there in Nigeria as well. Precisely. And the other bit is, of course, we always forget the media. The media has really picked this up because we only associate sometimes media in Africa with war and politics and so on. But for the first time, the media has really put health on the front burner, and we believe this should not stop with Ebola. It should be a sustained, well-coordinated effort to pass messages, to educate people, to raise awareness about the future way in which we behave to prevent this type of situations. All right, Dr. Kizito Lubano and Professor Sunday Omilabu, do stay with us on the program. We'll return in a moment. Welcome back to the program. Now, Nigeria is a success story, but is it built on a solid health sector foundation? And how can Africa better prepare for deadly disease outbreaks like the current Ebola one? Still with us on the program from Lagos is Professor Sunday Omilabu, a consultant virologist. In studio with me is Dr. Kizito Lubano, a researcher at the Kenya Medical Research Institute. And joining me now from Washington, D.C. is Mr. Ni Akwete, a policy analyst. Gentlemen, welcome back to the program. Mr.
Professor Omelabu, to you there in Lagos. When you look at it, though, from across the border, what remain the institutional challenges, though, that are facing the other 3 countries that are yet to beat the Ebola virus?
Thank you very much. I think the key factor there is to actually mount surveillance at border posts, monitoring movement of people, which assisted, or I would say helped us much in Nigeria in curtailing this outbreak. I think we need to monitor the movement of people, monitor people moving from across the borders. At least we could see, you know, it's part of our culture, once an individual is sick, to make sure he moves closer to his own people. And that's a way diseases spread unwittingly. And the way we put monitoring at our land borders, especially sea borders, airports, has actually helped us.
Right.
And like I did say earlier on, that we are not relaxing. We're still putting this in place to monitor people as they're moving. Because not until the last individual with Ebola is identified and get killed. So all of us, we need to be looking out because this could be spread
right.
if not checked on time to other places.
All right. Mr. Akwete from Washington there, of course, you're now part of a task force that is monitoring the Ebola in West Africa. Though, what is your task force about, and what are your thoughts on Nigeria's and Senegal's success in ensuring that the Ebola virus is eradicated in Nigeria and Senegal?
I think, you know, I'm based in the United States, and so from that perspective, I do think that what Nigeria and Senegal have done need to be told much better in the United States. Yesterday, I was in the White House as part of a discussion by President Obama trying to get Americans not to feel too fearful and to treat Americans returning from those 3 countries, anybody returning from those 3 countries, not to be treated badly in the United States. And we had this discussion, and part of it was that, listen, the African countries, the work that they are doing, even the affected countries, the sacrifices that they are making, their doctors are dying, their healthcare workers are dying, and they are still on the front lines. They are the people burying the bodies and all that. Sometimes the story doesn't get out. So that is number one of the things that we are doing. Of course, my task force is part of the African Immigrant Caucus here in the United States. All the African immigrants here have come together, worried about a lot of issues, including Ebola, and we want the story of Nigeria's success, Senegal's success, and then the sacrifice by the people of Guinea, Liberia, and Sierra Leone. We want those stories better told in the United States.
All right. Dr. Lubano, though, I want to come back to you with what Professor Omelabu said there earlier about the level of preparedness. Of course, we're seeing many African countries now having short-term and probably long-term strategies to ensure that the surveillance and monitoring continues on their borders. What can you say, though, about the level of preparedness across the continent?
I think I would speak a little bit about Kenya, that we are prepared and learning lessons, particularly from where it started over the last 6 months, and particularly from Nigeria as well. We have identified isolation centers. We have also done a lot of training and covering basically the whole country in the configuration with our health systems, but we haven't stopped there. That we are looking at the health system, for example, as just the end point, but it's involving everybody, the other government agencies, the information agencies, the immigration, the security systems, and the administrative systems, and the traditional leaders in communities, as well as the religious leaders and other political leaders. So we have a collective, multidisciplinary type of approach in terms of preparedness. And I believe also at the African level, there is a lot of now mobilization of resources, with the World Health Organization having particularly become fairly aggressive lately with the specific targets, for example, that at least 70% of all the cases be identified within the next 60 days and put in isolation centers, and at least 70% of all those who have passed on have safe burials, so that their staff also training not only to screen, to detect, but those who are affected with having specific targets that at least 70% are buried in a way that doesn't encourage the spread. And we believe these are messages across the world now. We can't say there is any point in the world where human beings exist, perhaps even on the International Space Station, that human beings are not prepared for Ebola.
Has this, though, changed the way, because West Africa, this was a first for West Africa, though, has it changed the way that Africa will now react to pandemics in the event that there's another outbreak of a different, you know, fever or tropical disease or whatever? Has it changed the way Africans are now going to be reacting to that, the reaction mechanism?
That's an excellent point, that there is already now effort to recognize that we need a lot of coordination among Africans, and collaboration as well, and communication and sharing of information in terms of dealing with this type of challenges before even our other partners from other continents come. So yes, a lot of things that have not been happening, like sharing information, preparing to share resources like the centers in Kemri and in Kenya and in Nigeria, helping other countries which don't have diagnostic capacity is a very good thing. We are also sending health workers across borders to go and help where the epicenter of the Ebola is. So that's something new, and we believe this should be able now to be carried forward. All
right, Professor Omilabu, you did mention earlier on that until the last case has been dealt with, it is still not yet a spectacular success for the region, though. Has this changed the way Nigeria and the West African region, though, will be looking at the response mechanisms in the event of another outbreak?
Thank you very much. I think there is a concerted effort now among the leaders in the ECOWAS sub-region. The recent outbreak has actually heightened aggressive meetings among the health ministers in the sub-region. And this outbreak has actually brought them together to now kind of recognizing the need for surveillance, recognizing coordination along the sub-region, even in the whole of the continent, and of course sharing information, as my brother rightly put it. I think that one is in place, and that one is really assisting to curb the spread of this Ebola. And as you all know, with the ECOWAS Treaty, which allows a free movement among citizens, so the leaders cannot afford to have a concerted effort among themselves to make sure that they come together and stamp out the Ebola viral disease in the sub-region.
All right, we'll leave it there for the moment, gentlemen, but thank you very much for being on the program. Dr. Kizito Lubano, a researcher at the Kenya Medical Research Institute, with me here in studio in Nairobi, and joining me from Lagos, Professor Sunday Omilabu, a consultant virologist, and also joining us from Washington, D.C., Mr. Ni Akwete, a policy analyst. Gentlemen, thank you very much for being on Talk Africa. I'm Beatrice Marshall. Goodbye.